Sex selection. Selecting the sex of the baby. Why parents opt for sex selection? Over decades, the parents were fascinated in determining the sex of their baby according to biological and inherited belief. Sometimes a medical situation where there is a disease linked to either the male or female genes. Since the 80s, the researches are done in order to determine the gender of the baby, which is determined by the type of chromosome in that particular sperm, X chromosome or Y chromosome. At the same time, the oocyte only contains X chromosome, so when fertilization occurs between an X sperm and an oocyte, the embryo will be a female, XX, while if a Y sperm meets the oocyte, then the embryo will be a male, XY. There were some beliefs that when a fat man marries a thin woman, they would produce only female and vice versa. There were also some who believed that if they eat spices, meats, or salted fish and the testes of animals, they were to produce male babies, while others thought that if they had the intercourse during the conjugal day, they were to produce male, while during individual days they would produce females. Here are some methods that can be used to increase the chance of having a male baby. 1. Following certain diet to select the sex of the baby. Rajan al-Jushi researchers proved that the female diet affects the gender of the baby, and this occurs due to its effect on the sperm receptors in the oocyte wall, and via these receptors, the sperm penetrates this wall and fertilization occurs. When there is a high sodium and potassium intake and a low calcium and magnesium in the female's diet, the oocyte wall will change to attract the Y sperm and exclude the X sperm, and at the end will produce a male baby. When there is a more calcium and magnesium in the blood and a low sodium and potassium, that will attract the X sperm and exclude the Y sperm, and at the end produce a female baby. The balance between sodium and potassium versus calcium and magnesium affect these receptors, which change the wall of the oocyte to favor the attraction of either a male or female sperm. In order to follow this method, the female should follow a special diet for at least 2 months. Timing intercourse to select the sex of the baby. This method depends on the molecular weight of the sperm. Researchers found that the Y sperm has a low molecular weight, so it is faster in movement but lives shorter. On the other hand, the X sperm has a heavier weight, then slower motion but lives longer. So we can calculate the time of ovulation and determine the time of intercourse according to desired sex. If intercourse occurs 12 hours prior to ovulation, a baby boy is favored, but if it occurs several days before ovulation, it will favor a girl. If you want a better result, you should combine this method with the diet described before, and also you should calculate the time of ovulation precisely, because it differs from one patient to another and from 1 month to another in the same person. Vaginal douches to select the sex of the baby. An acidic media in the vagina favors the X sperm, while alkaline media favors the Y sperm. This increases the success rate of having a male baby by 5%, and it is done using vaginal douches that can be bought from the pharmacy. How can the female follow the diet and maintain timing intercourse with the help of vaginal douches under medical supervision? The patient should follow the described diet for at least 2 months before stimulating the ovary, and before that, we should complete these investigations. Sodium and potassium level for those who desire a baby boy. Blood calcium and magnesium level for those who desire a baby girl. If the woman wants to achieve a pregnancy of a baby boy, she should have intercourse after ovulation immediately, and this is combined with alkaline vaginal douche half an hour before the intercourse. If she wants a baby girl, then intercourse should occur 24 hours prior to ovulation, and this is combined with acidic vaginal douches half an hour prior to intercourse. XY sperm separation and intrauterine insemination for sex selection. This is done after inducing the female's ovary by medication to increase the number of follicles in order to increase the chance of pregnancy. Then the semen is inseminated into the uterus after treatment, and separation of the sample is done in the laboratory. This method is not 100% accurate, so you can be pregnant with the undesired sex. To increase the chances of pregnancy with the desired sex, the female should receive the appropriate diet, consider timing of ovulation, in addition to the IUI. There are many ways to separate the sperm. Some methods depend on the molecular weight of the sperm, others on electronic activity, others by passing the sperm through albumin. But all these methods are inaccurate. Cytometry sperm separation flow for sex selection. In this method of sperm separation depends on DNA content of the sperm, and it's called cytometry sperm separation flow. It depends on the fact that X sperm contains 2.8% more DNA than the Y sperm, and accordingly, using flow cytometer instruments, they can separate the X sperm from the Y sperm. To confirm the separation, they use FISH method, which gives the Y chromosome, the Y sperm, the green color, and the X sperm, the pink-red color. With this method, they can separate Y sperm with 73% accuracy, X sperm in 88% accuracy. Usually, the semen contains 50% Y sperm and 50% X sperm, but there are some exceptions, and this sample is used for IUI or IVF or ICSI, with the success rate reaching 90%. This method is only done in certain centers of the world. Preimplantation genetic diagnosis for sex selection. This method is 99% to 100% accurate, and before continuing with this method, there is several points to consider. The wife's age, how many children they have and their gender, medical health of the wife and the ways of delivery, if the couples can't cope with a pregnancy of the undesired sex. This method includes the following steps. First, ovulation induction using injections. During this time, the follicle size is measured till it reaches the appropriate size. Second, pick up of the follicle via the vagina under general anesthesia, and then insemination of the oocyte by the sperm is done under the microscope. Some people might ask if it's possible to separate the Y sperm from the X sperm before doing insemination in order to increase the number of desired sex embryos, but researchers found no difference in the results. Third, embryos are transferred to the uterus after 3 days in the incubator when they reach the 6 to 8 cell stage. A cell from each embryo will be taken later, and a chromosomal analysis is conducted to determine the sex of the embryos. Fourth, the normal embryos having the desired sex are transferred to the uterus. Sometimes we can't transfer any embryo if they were abnormal or of the undesired sex. Finally, the patient should receive some medication and wait 2 weeks before she does the pregnancy test. This method's success rate is almost 100% without any risk on the fetus regarding this morphology, but it's associated with lower pregnancy rate than other methods of IVF without determining the sex of the baby. Chinese calendar for sex selection. This calendar is one of the first methods used to determine the sex of the baby. It dates back to 700 years ago. Astronomers correlate the age of the fetus and mother age with water, earth, wood, fire, metal. This doesn't depend on any scientific basis, but this method made the chance of having a baby boy 60%. It's usually 51%. So there is 9% difference that we can't ignore. The success rate of each method is as the following. Diet with timing intercourse and alkaline douche, 70% baby boy. Intrauterine insemination with diet and Chinese calendar, 80% baby boy. Alkaline vaginal douche, 56% baby boy. Diet with alkaline vaginal douche, 65% baby boy. Chinese calendar, 60% baby boy. IUI only, 55% having a baby boy. PGD, 99% having a baby boy. Natural intercourse without following any method, 51% having a baby boy. Commonly asked question. Is sex selection by any previously mentioned method affect the health of the baby? The answer is no. Is their method associated with this morphology or abortion? The answer is no. Is there a guarantee for these methods? We can't guarantee these methods except what is previously mentioned success rate. What is the privacy in doing these methods? We guarantee 100% privacy. When the mother can know the gender of the baby? At the 12 to 13 weeks of pregnancy through 4-dimensional ultrasound. This is Dr. Rula Al-Hamid, a specialist in infertility, IVF, gynecology and obstetrics in Dr. Najib Layous Center.